All right, so we are going to go ahead and talk about panel placement for all the different body parts and how to position the panel over different areas of the body, okay? First, I also want to mention to you that you will receive a black vinyl material. Now, I do actually have some of that material inside of the pillowcase, as you can see, but we like to use this so we can change it for sanitary purposes. But ultimately what you will do is you'll just fold it a couple times so that way you can place it right over the breast area or just any area in general that the patient does not want to have treated. Okay, so I'm going to go ahead and show you how to do panel placement for the waist buster. And I'm going to be showing you how to do this on the female body, okay? So you're going to take that vinyl and place it over the breast. The female's arms can be down beside their body. You could also tuck this under the bra as well. You just want to make sure that the vinyl is covering up underneath so that way no light is going past the bra area and potentially treating the breast tissue. Now for the female, we do just ask them to separate their feet just a little bit so that way that little bit of light can get on the upper thigh area. Then you're going to bring your machine and you're going to make sure that the panel is going directly over on top of the stomach and upper thigh area. Now I am right-handed, so I'm going to place my left hand on the body of the machine and I'm going to take my right hand here at the top joint and I'm just going to push and pull at the same time. When I do that, I'll kind of get to a point where I stop and then I'm going to straighten out the panel and then I'm going to bring it down a little bit further, but make sure I have enough space to treat at about a 6.7 inch distance from the patient's body. Next thing I want to do is I want to make sure that the panel is completely straight and even in the center of their body. Once it is, I'm going to go ahead and set my timer for 8 minutes and treat 8 minutes in 4 separate areas. Okay, so after her 8-minute treatment is up, now you're going to go ahead and bring the panel up. Make sure you leave a little separation from the arm to the panel so you do not scratch it. This is where I'm going to also ask my patient to rotate to her side. Either side is fine. We're going to treat both sides. Now for the female patient, again, I want to make sure that the vinyl is just right at the bra line area, not past it. I'm going to ask her to take her top leg and make it straight. And the bottom leg is going to be more at an angle. So we're just going to kind of bring this leg out just a little bit. So that way we can get a little bit of light on the inner thigh, but we are mostly focusing right here. Again, you want to have as much bare skin as possible. So now I'm going to go ahead and show you how to position the light for the side. So again, you're just going to repeat the same step. I'm going to straighten the panel. And it is okay that you are going to be maybe a little bit closer to the hip area because you're going to have some areas of the body that is a little bit further away from the light. Okay, and then once you have it in the right position, just make sure when you are turning on the light that the light is shining in all of the areas that you want to target. Okay, so now we have our patient rotated to their side. For the female patient, what we're going to ask them to do is bring their arm over their head. You're going to make sure that that vinyl does not go past the bra line area. Their top leg will be straight and bottom leg will be at an angle. Now I'm going to go ahead and place the panel directly over the hip area. I'm going to make sure it's straight. Okay. And then make sure once you turn on the light that the light is shining in all of the main target areas. Okay? All right, now after repeating treating the other side of her body with her arm over her head, top leg straight, bottom leg at an angle, now I've asked my patient to lay on her stomach where we can treat the back of her thighs, her bottom, and the back up under her bra line area. Now, this is where we no longer need to use the vinyl. However, the only time that we will use the vinyl is if your patient would prefer not to treat the bottom area. But we are still going to position exactly the same way. So let me go ahead and show you. Okay, so you want to make sure, again, that the middle of the panel is going directly over the bottom area, and you're able to get a little bit of light on those back upper thighs and half of her back right under the bra area. Just make sure before you turn on the light that the panel is straight and centered with her body. Okay, so if you have a patient who would like to do facial treatments, we actually use a longer treatment time. We use 20 minutes. Now we do 20 minutes to each side of the face and neck, and I'm going to show you exactly how we do that. Now, with the vinyl, you still want to cover the girls, and I'm going to go over some protocols with you on things to do and not to do during a facial treatment, okay? So I'm going to go ahead and cover the girls, okay? And then what I'm going to have her do is bring her arm behind her back like that, and I'm going to ask her to kind of bring her face into the pillow just a little bit more. And I'm going to gently bring the bra strap down and just have this neck and décolleté area more exposed. Make sure those girls are covered. Okay. And then also, if your patients would like to treat the top part of their hand, you can always ask the patient to kind of turn their hand this way, okay? Now, once you have your patient in position, this is when you can go ahead and place the panel directly over the face area. And you will have this for about 6.7 inches away from the face and neck as well, okay? So I'm gonna go ahead and do that for you. And then I'm gonna go over the protocols for optimal treatments of the face. So the feet of the machine are going directly under the table. And I'm going to go ahead and bring down the panel. Okay, now if you find that your patient seems to be further away from the panel, what you can do is you can just ask your patient to move very slowly and come a little bit closer to the edge of the table, okay? Because ideally what you want to do is you want to have it to where her face is more in the middle of the panel. You may even notice there's like a little arrow right here. That kind of helps you make sure that all of the body parts are centered, okay? Make sure that that panel is about a 6.7 inch distance from the panel to her face, and then you can go ahead and begin with treatment. Okay, so let's just say that you have a patient who solely just wants to focus on neck and jowl, not so much the entire face, okay? So mind you, you are still going to get a little bit of treatment in the face area, but it will be more focused in neck and jowl area and a little décolleté, okay? We call this just a neck treatment. We just do one 20-minute treatment. So what I want to do is I want to make sure that my patient's neck is completely flat to the bed. So I'm going to remove the pillow, which we use pillows for comfort anyways. And then what I'm going to ask my patient to do is just tilt her neck back as far as she possibly can. So that way this area is fully exposed. Now again, I don't want to treat the girls, but I do want to leave some of her décolleté exposed as much as possible. You can also ask the patient to bring their bra straps down if they want to treat a little bit of this area as well. Remember, the same protocols apply: no creams, no lotions, no makeup, and no jewelry. Now I'm going to show you how to position specifically to target the neck in this main direction, okay? So you want to make sure that the machine is facing this way towards the bed, okay? Now, what you'll do is you'll take your panel and you're going to move it completely outwards, like that. There is a joint here, okay? So this joint allows you to move the panel up and down or side to side. So what I'm going to do is I'm going to hang on tight to the arm of the machine and just pull the panel in her direction, okay? Then I'm going to move the feet under the table. I'm going to get the panel a little bit closer to her. I'm going to push down on the arm so I can get it close. And then I'm going to just turn the panel where it's kind of facing her a little bit more at an angle. And then you can just keep tailoring the panel and the machine as needed to get it in that sweet spot. So you want it again at about a 6.7 inch distance away. And again, my hand is right here at the bottom. So that way I know that I'm not getting too close to the girls. And then I have this at the perfect angle where it's not covering her entire face, but we do have direct contact to her neck and jowl area. Okay. Okay, so we're gonna go ahead and do arm treatment. So this is the type of treatment that you can do at 8 minutes or 20 minutes, again at 6.7 inches away. So remember, always cover the girls, okay? And you see how your patient here has her arms back behind her head. You want to make sure that you are exposing that underarm area. The light is a 17 by 23 inch spectrum of light, so it will cover the entire arm and a little bit of the forearm as well. So all you have to do, this one's very, very simple. You just make sure that the light is going directly on top of her forearm and that the panel is completely straight. And you're going to ask the patient to turn their head to the opposite side of the panel so that way there's no direct light into the face and eyes. And then you can treat for 8 or 20 minutes. Okay, so remember the standard treatment time for face and neck treatment at the same time is 20 minutes. So all you're going to do is just repeat the same position on one side of the face to the other side of the face. So she will rotate on her other side. Now, the protocols for facial treatments is no makeup, no creams, no lotions, no jewelry, so no earrings, no necklaces, nothing. Everything needs to be completely bare. Hair also needs to be pulled back, so if you have a hairband, a hair tie, that is optimal. Also for picture taking as well. So remember, everything that you do, you want it to be consistent before and after treatment. Okay, so we're going to go ahead and do a breast reduction treatment. We are only going to do one 8-minute treatment. Make sure that your patient is wearing the bra that they would ideally like to fit into. What you're going to focus on is treating the top part of the breast at a slight bit of an angle. So I'm going to show you how to do that. We'll just have the light a little bit at an angle. So you are going to treat the décolleté and the breast tissue. The light will go through the breast tissue and you can treat in 8 minutes.